Well, we know that Black people in North America are disproportionately affected by COVID-19, but surveys in the U.S. show they are also more hesitant to receive the vaccine. On Wednesday, we spoke about a similar hesitancy among Indigenous population here in Canada. And to explore this idea further, I'm joined by Jamil Jivani. He's a special advisor to Ontario Premier Doug Ford and a community advocate. Good to have you back on your morning.
Good morning.
In this survey done by Black Americans, they also went into some of the reasons why this hesitancy occurs. And they found that it comes from years of medical abuse, historical medical abuse, like the Tuskegee experiment. This is where Black people, men in particular, were infected with syphilis so they could study the effects. The problem came in when there was a treatment, but they weren't offered the treatment. There is a similar distrust within Indigenous communities here in Canada in relation to smallpox in residential schools. How do you think Black Canadians will respond to this vaccine?
I think it's right to say that history plays a part in this. I think that even though we don't have the exact same history as the United States, we do have a long history of the Canadian government abusing and not treating fairly or rightly Black Canadian communities. So history is relevant, but there are a lot of modern examples of where the distrust also comes from. Imagine you're in a neighborhood where you're sending your child to a failing school, you don't see economic opportunity for the next generation in your neighborhood, and you think, well, the government doesn't care about me, obviously, they're leaving me behind in this economy, and then now you're being asked to trust that very same government to give you health care in a proper way. It's really a matter of building trust and showing that the government that's coming to you with a vaccine is also a government that cares about your children and the future of your family.
I think it's a part of that discussion, ongoing discussion about systemic racism. It's not just about name calling, it's also about things like schooling, as you pointed out, and access to health care. Marginalized communities in Canada have been hardest hit by this virus in terms of infection rates, but also economically as well, and job losses. What are you hearing from Black Canadians during this pandemic time?
Well, I think that a lot of the organizations that Black Canadians rely on for services and for community support, like churches and mosques, parent associations, service providers at the grassroots level, they need support. They need government support. They need financial support. They need to be able to operate effectively given the constraints we have during these lockdowns. And I think that communities need to see that level of infrastructure and that level of support. And those are where the relationships exist. So if we're going to be talking about vaccines and having a plan for the new year, we need to have partnerships with those organizations that have meaningful relationships in the community.
In the U.S., we have watched how the government there understands that there's this mistrust. I mean, it is not by coincidence that one of the first nurses to be injected with the vaccine was a Black female nurse. How can the government here in Canada build trust when it comes to the vaccine?
I think the main thing is going to be showing that there is a plan and a vision for not just how we're going to help neighborhoods and communities get through let's say the next 6 months or 12 months, however long it may be until vaccines are available for the average family, but also a vision for how your life is going to be different when we come back. When this pandemic starts to disappear, when life gets back to normal, are you going to be returning to the same inequalities that existed before? Or do our governments have a vision for your life to be different, for your life to be better? And if we can articulate that sort of vision, I think people will trust that this is not just an exercise of showing up at your door when there's an emergency, but there's also a vision for how your life can be better.
Jamil, really quickly, we know that Toronto Public Health for months has been calling for a change in how access to testing has been done by our marginalized communities who have been hit astronomically. Their percentages are so much higher than the rest of the population. What does the Canadian government need to do now?
Well, part of what I think the Canadian government needs is a neighborhood strategy. Just like they're partnering with First Nations communities and understanding we need a geographic focus when working with Indigenous communities, we need a geographic focus for other working class communities with large populations of frontline workers. We're talking about a neighborhood strategy, a geographic strategy. I think that's necessary.
Jamil Jivani, always great to hear from you. Thanks for being back on your morning.
Thanks for having me.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.